So today, first of all, I want to thank Dr. Meenakshi because he's a very cooperative doctor and always help us in the Siddha field of Ayush. He always guide us and he always provide us with an expert for the webinar. And moreover, I want to thank Dr. Kanya Kumari who has accepted our request for this webinar. Today, the topic is uniqueness of Siddha diagnostic methods. So, Dr. Kanya Kumari is a professor in Government Siddha Medical College, Chennai. Previously, she has worked as a lecturer and a reader in a Santagiri Siddha Medical College, Trivandrum also. She got a Siddhanta Ratnam title from Saiva Siddhanta Vegupu. I'm really sorry if I'm pronouncing something wrong. And she has attended many workshops, conferences, and given lectures and even published papers. So, Dr. Kanyakumari, we are here to listen to you, and it's up to you. Please tell.
Thank you very much, Neha. I feel very privileged for being a part of this. Am I audible to you all?
Yes, you are audible, loud and clear.
Yeah, okay, thank you. First of all, I would like to thank HSSC for giving this wonderful opportunity for sharing my views among you all. And I would like to thank our institute director in charge, Professor Dr. Sendilvel, for giving this opportunity. And I would like to thank Professor Dr. Meenakshi Sundaram sir, who has immense confidence in me for giving this platform. And let us enter into our program. Let me share the PPT. To see the screen.
Yes, we can see.
Yeah, okay, thank you. I'm sorry. Wait a while. Let me get the. Yes, and now we are going to see about the uniqueness of Siddha diagnostic methods. You may all wonder, there are diagnostic methods in all the systems and all the other things. And the Siddha system of medicine is a time immemorial medicine which has been incorporated by the spiritual scientists, Siddhas. So, am I audible to you all?
Yes, madam. Loud and clear.
Okay, thank you. So the thing is, the Siddha system of medicine is time immemorial. It has so many minute things we have to notice about. Even though we have so many diagnostic methods in the modern technology, there is a minute, unique thing about the Siddha diagnostic methods. The Siddhas have an immense love and care about the humanity, which they are suffering from so many ailments and all the other uh, things due to their diet and habits. They want to save the humanity, so that they have mentioned so many types of presentation. What would happen if the change occurs? What would happen if the change occurs in the body, means how it will be depicted, and what can be done for the changes if it is occurring means. So when we are saying about the Siddha diagnostic method, we have to know what is unique in this. As I said, there are so many diagnostic methods in the modern medicine, such as your lab techniques, and then so many MRI, CT, etc. What is about unique about the Siddha? The thing is, the Siddha can say about all the three: what has happened in the body, what is happening in the body, and what is going to happen in the body. The thing is, if the the dietary changes and what the habitual changes will make our body ailment means, it will be excreted or it will be depicted in the urine, and that can be easily identified by the presentation of urine. So that delivers the thing what had happened in the body. And for what is happening, we can see the nadi. Nadi is a basic thing in the diagnostic method for a Siddha system of medicine. While feeling the pulse, we can judge what is going on in the changes in the humors of the body. And in the next one, what is going to happen, we have a unique methodology known as Manikadai Nool. In that Manikadai Nool, we can even note the changes in the body, whether in a prognostic way or in a low prognostic way. If you are taking a medicine means, or if you are affected by the diseases means, it will be depicting the clear picture whether we are on the pathway of correct prognosis. So, the Siddha system can say what is happened in the body, what is happening in the body, and what is going to happen even if you are taking the medicines. While doing all this, while saying all these things, we have a perfect stitched or tailored mechanism known as Envagai Pervu, which is nothing but the 8 diagnostic tools of Siddha diagnosis. So that is, it involves the 8 main parameters known as Nadi, Parisam, Na, Niram, Mori, Viri, Malam, Motiram. They have mentioned this as a Maruttuvar Ayudam. The thing is, it is the tool which easily makes the physician to diagnose or to know the present condition of the body. The basic thing of Siddha system is we have to know the cause of the disease. Noi nadi, noi mudal nadi, adudanikum, vai nadi vaipachayal is the Tirukural, which traces the importance of the diagnosis. That is, merely treating the symptoms doesn't give a proper cure to the patient. We have to note the proper cause of the disease. Noi nadi, we have to see the presentation of the disease. Noi mudal nadi, the primordial cause of the disease, which causes or which is the reason for the disease. And then adu tanikkum boy, that is the pattern or the condition or the methods to cure the primary cause of the disease, so that we can cleave all the root cause of the disease, so that the patient will get a complete cure. So that is the basic thing of Siddha method of treatment. So in this Siddha method of treatment, the diagnosis plays a very, very vital role. In a poem, it has been mentioned that as though a physician know all the medication, higher grade medications, if he doesn't know the basic knowledge about the disease, He has to know each and nook and corner of the disease so that he can easily give the medicine and can cure the patient very easily. So here it denotes that the diagnosis is the main part in the treatment. So while getting into the diagnostic methods, we have, as I have said, we have 8 tools of diagnosis. That is, we have Nadi, Parisam, Na, Niram, Mori, Vili, Malam, Mutiram. The Nadi is nothing but the pulse. The Parisam is the touch or the skin presentation. Na is the presentation of tongue. Niram is the body complexion. Mori, the phonation of the patient. Viri, the eyes. And Malam, the excretory product that is feces. And Motiram. In all these things, we have a pattern of examining. That is, Poriyar Terdal, Pulanar Terdal, and Vinadal. This is nothing but the examiner, that is the physician who is examining the patient. He has to examine with all his senses open, and also he has to examine the patient's all the senses too. So in this, these these 8 tools. Let me see one by one. In this, the parisam, I just switch the order due to the importance of each and everything. The first one we are going to see about is the parisam. Parisam or the touch sensitivity is nothing but the thing which we feel on touch. If there is a change in the body means, it will be depicted in the surface. We have the 3 main primordial humors known as Vali, Aral, Ayam, which is a subtle force which drives the body. In this, the surface presentation of the skin, the parisam that mainly determines or mentions the skin presentations. In the surface of the skin, if we see the surface of the skin as a rough or a dry or any concreted like thing means, it represents the dryness due to the vadam. The vadam will be the main cause due to the dryness which has been exhibited in the skin. And the next one is the sheen or the shining presentation. We will say that as a luster. We can say that as a luster too. So that is the main part of pittam. That is the we can say that as a prasaga pittam. That is mainly responsible for the luster of the, and the secretion is the part of kabam. In this, if the skin is not with the proper sebaceous secretion or any other, if it is having the increased secretion means it will be producing more amount of oozing or any serum or blood or anything. If it is a low secretion means it denotes the changes in the kabam. So by noting whether the vadam or pittam or kabam is affected in a person, we can choose the way of medication. We can choose the line of treatment. If the vadam is affected means we can treat the medication along which pacifies the vadam. If the skin luster or the skin complexion or the thing is reduced or changed means, we can enhance pittam so that the treatment strategy will be pacified. And if it is more secretion means it denotes a more presence of kabam, and we have to reduce the kabam. Or if it is low means we have to add substances which increases the kabam. By mere touching the surface of the skin, we can judge which nature of presentation is there. That is the skin presentation, that is the surface presentation, and along with that, we will see the warmth of the body. That warmth is nothing but whether it is so hot or whether it is medium hot, veppam, mida veppam, or kulirchi, that is cold one. So in this cold presentation denotes the increased presence of kabam. The increased hard presentation will be seen as veppam. And if it is normal or if it is the dry presentation, means it denotes the vadam. So by noting the parisam, we can see the changes in the surface as well as the body temperature too. Then the next tool is the na. The na include the na include doesn't not only the na, it includes all the oral cavity which acts as a index of intestine. If there is any change in the gut, we all know that the gut is the main area for the maintenance of health. So the thing is, whenever there is a change in the gut, whenever there is a change in the digestion, or whenever there is indigestion, or whenever there is a abnormality present in the gut presentation, means it will be exhibited in the na. So the na, as I have told, not only it infers the tongue, it involves the oral cavity, the secretion of saliva, the secretions in the mucous membrane of the oral cavity, the teeth, and all the things. So mainly, if the tongue is with a coating, means we will be saying that it may be due to abnormal digestion, which causes the constipation in the body, which represents as a increased sedimentation of the food substances or the secretions in the tongue. Or if the color of the tongue have been changed, means if it is dark colored, it denotes the changes in the vadam. If it is yellow or red color or orangish presentation with the somewhat coarseness, we can say that as a pitta changes. And if the color is white or paler, it may be due to the kaba changes. And then if we go on to the coarseness, coarseness is nothing but the surface of the tongue, in which the surface, if there is an atrophy in the tongue, this atrophy may cause the slimy presentation with loss of taste buds. The coarseness will not be seen over that. It may be due to the atrophy of taste buds leading to slimy tongue, and that may denote the anemia. And also, if there is no secretion in the salivary glands, or if there is a minimal secretion in the oral cavity, that also causes the coarseness in the tongue, which makes the dryness. That dryness denotes the increased heat in the body also. So by calculating or by mere seeing the presence of oral cavity and the tongue presentation, we can judge the changes in the gut. If there is any secretory changes in the gut, means it will be presented in the abnormal taste perception. That is, the taste is the combination of, according to the Siddha system of medicine, the taste is the combination of 5 elements. I think you all aware of 5 elements, that is air, fire, water, and space. So these combine to form various tastes, in which if the tongue tastes invariably or in the different way, means it also mentions there is a change in the gut presentation. For example, if a patient is complaining about the bitter taste when tasting all the foodstuff, means it presents the increased pitta in the body. Whereas if the patient is complaining about the sweet taste or a very mucousy presentation in the oral cavity, means it presents the increased presence of kabam. If they feel more astringent taste in the oral cavity, that increases or that induces the presence of vadam in the body. So by noting each and every minute characters of the oral cavity, we can correct the intestine. The intestine is the index of health too. Now the research have been entering into the site of gut biota, gut biome, and all the other changes which makes the normal presence of gut biota leads to normal health. Normal gut biota leads to normal immunity of the body. Likewise, we are all now entering into the research area. But even if by seeing the tongue and the oral cavity, we can judge whether there is absence of any presence of any abnormality in the gut, and we can treat accordingly so that this health can be restored properly. Then we can pass on to the next one is the niram. The niram is nothing but the exhibit of the entire system. It not only represents the color of the skin. Actually, the niram, it usually misunderstood that it is the skin color only. But the thing is, the complexion. Siddha system is very, what to say, it is prophylactic, preventive, and all the depicting one. In this, we will be saying that Uraita Karupan Vadarohi. Actually, the Vadarohi will be like that of a dark color. Araita Manjalai Kulittonum Avan Pittarogi. Actually, the Pittarogi will be like that of a yellow colored, and then Kabarogi will be of white color, that is pale color. So this color itself denotes the presence of disease. If we feel the darkness or if we feel any change in the complexion, we have to address that. And then in constitution means actually the constitution is the genomic presentation. We all say that we classify the human individual according to the body constitution named as Vadadegi, Pittadegi, Kabadegi, and then mixture of these three humors, Vada Pittam, Vada Kabam, Pitta Kabam, Pitta Vada, etc. So each and every constitution of the body presentation will be presenting with the specific color and the characters. So even in the genomic level, the niram can be presenting the sense of the each and every character of a person. And then the connectivity is nothing but the subtle changes in the body, that is the Sukuma body. We will say that as a Sukuma Sariram and Stula Sariram. The Sukuma Sariram is nothing but the subtle things which cannot be visualized from the interior or in the naked eye, whereas the Stula Sariram is the one which can be easily seen to the exterior. The skin or the color of the skin is the connectivity between the Sukuma Sariram and the Sula Sariram. There is a change in the Sukuma means if there is any change in the internal presentation means it will be depicted in the color of the body. This connectivity, we usually say the phrase like that of Vadam Aladu Meni Kedadu. The Vadam is the one which is main responsible for all the activity in the body. We may have the diseases due to Pitta, but that Pitta changes has to be depicted to the exterior with the help of the movement or the changes or the impulses by the Vadam. All the movements are by the Vadam. So likewise, this changes, the Sukuma changes in the body will be connected to the exterior in the form of stula in terms of niram, which can be mentioned as a hyperpigmentation, hypopigmentation, and then in the modern science, it can be measured as a macule, papule, nodule, vesicle, etc. So, whenever there is a change in this, if there is a Kaba change, means it will be having a oozing or a pale colored presentation in the skin. If it is with the Vada, it will be producing as a dry and the dark colored presentation, hyperpigmented presentation. If it is a Pitta, it will be having a specific yellowish or orange coloration in the body. Likewise, the Niram is the exhibit of all the entire system. So let me pass on to the next one is the Mori. Mori is not only the phonetics, it is the roar of your health. Usually, if we are in a healthy situation only, we can express our all the present things in a normal way. So it may denote the normal healthy presentation. If a patient coming to you is having a ailment, means it will be carrying the silent whisper of pain. We have to notice that change in the Mori. So we can notice this change in terms of the pitch and the loudness of voice and the clarity. The pitch is nothing but the some people will have a shriek voice. Some people will have a bass voice. Some people will have a normal standard voice. Even though these voices or belong to Vada, Pitta and Kaba category, if they are having any underlying illness, the phonation will not be in a proper way. That may be the associated, as I have said, the whisper of pain will be associated with the presentation. So we have to watch. We have to, while conversing with the patient, we have to notice even the minute change in the pitch of the tone. And then the next one is loudness of the voice. The loudness, it includes the, we will be saying this as a தாழ்ந்த ஒலி, சம ஒலி, அதிக ஒலி. That is the volume of the voice, how they can express. Somebody, if they are having any other ailment, means, for example, if a patient is having a hypothyroidism, means they will be having the hoarseness in the voice. That will be having a additive of the hoarseness. It may be due to the kabam, accumulation of kabam, which causes the thickness in the voice presentation, and that may denote the increased kabam in the body. If it is very shriek or if it is very low, it may be due to the low movement, or it may be due to the thinness of the voice caused by the increased heat in the body. Likewise, the loudness itself present the condition of the body. And then the next one is the clarity of the voice. That is, we can say this in way such the articulation of the words. So we all know that if you want to say something, we must have a combination of all the words which we stored already in our brain. That is, for example, if I want to say something, means I will pick up the words which have been stored in the memory. And these words will be articulated with the help of our memory and the comprehension, and it will be connected to the motor system. And this motor system will carry all those things through the movement of our tongue and then vocal cord and the mouth and the teeth, etc. So this articulation, if there is any change in this movement, that is change in the vadam of the patient means this will be affected. This will be presenting the incoherent speech, uncomprehensive speech, the slurring of speech, and there is uh, the hindrance in the speech. Sometimes they can't comprehend what we say. So, by noting all these things, the changes in the vada, changes in the pittam of the sound, and change in the presentation of the pitch, we can judge the ailment in the patients. So, the mori is the roar of the health, which can be identified even with the conversation with the patient. And then the next one is the very a see-through. That is, a physician must not miss the change in the eye. So the eye, the physicians, with the physician's eye, we can see through the eyes of the patient in which the vision, how the vision will be, whether there is a change in the vision. The change in the vision denotes the acuity and the changes in the, what to say, kabam, that is due to the secretion affected in the eyes, which alters the lens position and the lens focusing. So this, by judging this, we can alter or we can bring back to the normal condition. Whereas the shade is the color of the eye, that is the hue that is present in the eye, cornea or conjunctiva, etc. That this color will be present with the presence of various substances. That is, if there is any increased pitta in the body, means it will be yellowish color. The conjunctiva will be yellowish in the color. If the color of the conjunctiva is white or pallor, it may denote the anemia in the body. And then if there is any increased secretions in the eyes, means it induces the kaba presentation in the body. Whereas the movement of the eyeball or the movement of the eye denotes the vada presentation. That is, if there is any change in the movement, it affects the vision. So the eyeball has a tendency to rotate all around the, that is the pupil can see all the 360 degree in front of us, the 360 view of the vision, what is in front of us. If the eyeball cannot be moved properly, means it may be due to the neuronal or the nerval involvement, which denotes the vada involvement. Whereas this equity, the thing is, the formation or the clarity of the vision, the sharpness of the vision is mainly due to the pitta, which acts as a, that is, even though we are having the functional eyes, if that is anatomical eye, if there is no light, means if there is no coordination between the eye and the brain, means we cannot see. So that coordination is carried out by the pittam or the alosagam. So that is mainly responsible for the vision. So if there is any changes in this, we have to address alosagam so that we can bring back the person's vision into the normal condition. So not only the things, the vada changes, the pitta changes, and the kaba changes will be presented in the eye. By noting this, we can easily assess the changes in the eyes and the humor also. Next one is the malam, that is the fecal matter. The significant presentation of the stool is, the stool is significant about the substance, what we have taken, what we have eaten, and what we have utilized from the food. That is, whenever we are eating, nowadays we are not having a proper dietary pattern. On those days, we used to have a balanced diet containing all the six tastes. But now we are not having all those six tastes in a balanced manner, and thus it will affect the even the humor and also the physiology of the body. So if we are taking more amount of a single taste means it will be uh, taken up to the threshold, and the excess will be held out or the expelled out through the malam. Sometimes the absorption may not be uh, proper, or sometimes the absorption may be affected means even the needed thing will also be expelled through the stools. So we have to be so sure about the presentation or the fecal matter. The presentation of the fecal matter has to be examined properly. That is the color, the consistency, the smell, and the we can ask the patient about the frequency and the hardness, etc. So the color of the stool, if it is a pale colored stool means it denotes that the abnormal digestion, and there is a obstruction in the gut, that is the secretions, which denotes the white colored stool or a clay colored stool. If it is dark colored means it may be associated with the changes in the vata, or it may be due to the any bleeding inside the tract. If it is a fresh red colored beans, it may be due to it will be seen as said as a hemophysia. Or if it is dark colored as a black or dark coffee colored means it will be seen as said as melena. It may be due to the abnormal uh, loss of blood from the gut. So, by noting the color of stool itself, we can judge that whether the digestion is good or abnormal. If the digestion is normal means, then the stool will be of an copper or a light yellow color with the um, normal consistency, that is a solid, a semi-solid, or a solid consistency. The consistency of the stool itself denotes the movement of the peristaltic movement of the gut as well as the presence of foodstuffs. For example, if you are taking more amount of fiber foods, which enhances the bowel movement means it will be having a normal consistency. If the water intake is reduced, or if the pitta humor have been increased in the body, or if the vada humor is increased in the body means there will be the dryness associated with the uh, fecal matter. If the dryness associated means it denotes that the water in the intestine or the intestinal foodstuffs is reabsorbed more, which denotes the low water level in the body, and also the increased heat in the body. Usually, we have a secretion in the large intestine to facilitate the defecation properly. So, this also denotes the absence of that or reduced presence of that secretion also. If the consistency is very loose, or if the consistency of the food, that fecal matter is along with the foodstuffs or undigested food materials means, or it will, if it will may be associated with the mucus or blood means, it affect the consistency. It causes the loose stools associated with the froth, associated with the blood, or associated with the mucus while voiding the fecal matter. So if it is with a mucus, it denotes the prevalence of increased kaba in the body. And if it is so associated with the foodstuffs in an undigested manner means it denotes the gut biota have been affected. And if it is very hard, and if it is not with a proper water. If it is very pellets like means it denotes the Vada presentation. And usually the smell of the stool, it indicates the uh, gut softness. That is, if the gut is good, if the digestion is good, if the secretion is good, the smell of the fecal matter will not be offensive. If it is offensive means it denotes the increased fermentation or the loss of digestive fluid or the increased presence of digestive fluid in that, that denotes the smell. And then the frequency of stool. So the frequency of stool is usually in our Siddha text, we used to say that Mummalam Arunir. Actually, this is a thing. But since we have crossed so many generations and so many changes in our day-to-day habitual life, nowadays 3 times of defecation is not occurring. At least even uh, once a day is it's said to be normal. If it is not in a proper way, even it is not a single time per day means it denotes the constipation. So constipation denotes the increased presence of vadam in the body. Since arindidum vadam adangum malathinil. Usually if we have any pain in the body, you can notice that you will be having constipation. Or if you have the constipation, you will have a unexplained weight pain in the body. If you make the constipation relieved means automatically the patient will be relieved with the pain. So that is the management of Vada. So if the constipation is addressed properly, most of the pain will be reduced. The Vadam is said to be the main tool for creating the pain in the body. That is, it is the one which connects the pain to the brain. So automatically, if we subside the Vadam by having a proper bowel evacuation, that will induce the reduction in the disease presentation in the body. If the frequency is more, it induces the it presents the presence of more kabam or the abnormal vadam in the body, which uh, denotes the increased peristaltic movement in the gut. For that also, you have to address with the proper medicines which arrest the increased frequency. So when you maintain the gut, when you maintain the digestion properly, most of the diseases will be addressed very easily. For example, in our Siddha text, we will be saying that asiranamindri suram varadu. Usually, the indigestion is the main reason for fever. So we have to address this very promptly by noting the changes in the humor by the presence of stool. And the next important one is the nadi. The nadi is the rhythm of life. That is, uh, usually in our text it has been said that nadi என்றால் nadi alla. That is nadi mattum alla. Pulse is not just pulse, it is a pixel of microcosm. That is, it is a depiction of the even a micro change in our body. Microcosm doesn't, it represents the body. Macrocosm is the universe. Actually, the microcosm is a body. Whenever there is a change in the body, it will be depicted in the flow, presence of pulse, since the pulse is the depiction of each and every change in the physiology of the body. So while noting the physiology, we have to know about the formation, flow, and what we feel in the nadi. The formation of nadi, we will be seeing that as vali, ayal, ayyam. That is, in the modern science, we will be seeing that rate, rhythm, volume, etc. But here, the minute changes in the uh, nerve, that is a nadi, that is nerve, as well as in the circulation, as well as in the air perfusion, is presented as a nadi. For example, we have three main nadis, that is Idagalai, Pingalai, and Sudumunai, which combines with the air, Abanan, Pranan, and Samanan. So that is Idagalai and Abanan joins to form Vadanadi, which will be presented as the major Mathirai, having a one Mathirai. Whereas Pingalai Nadi, along with the Pranan, it will depict Aral, that is the major secretions in the body which maintains the basic heat energy. Whereas the Surumunai and the Samanan joins to form Ayam or Kabam, in which it is the main thing which maintains the body in a standard way, which is that is if the Vadam occurs more or the Pitam occurs more, means it will be presenting the dryness and the heat in the body. This Ayam is the secretions which maintains the Vadam and the Aral and all the body constitution in a normal way, which is responsible for the normal health. And we will be saying this Vali Aral Ayam in a pattern, that is having one Mathirai, half Mathirai, and quarter Mathirai, that is the magnitude of Vadam, Pittam, and Kabam. That is, this Vadam have one magnitude. Since all the other bodily movement depends upon the Vadam, it is the basic driving energy which circulates all over the body and makes all the functions in a normal way. And the Pittam is the one which produces the basal heat energy and which gives the combustive energy to the body, and this combustion enhances the energy production, and this energy will be dispersed all over the body so that it will function very properly. And this is said to be the standard one for calculating Vadam and Kabam. And this Kabam is nothing but the Nadi which is responsible for the maintenance of Vadam and Pittam in a normal condition. So, by perceiving the Nadi, we can find even a minute change in the body. That is, we have 10 places for perceiving the Nadi, among which the radial artery pulse is said to be the easier as well as the clear one to depict, in which we will be seeing the Nadi with all the three fingers, that is forefinger and the index finger, that is forefinger or index finger, and the middle finger and ring finger. In this, the index finger denotes Vadam, and the middle finger denotes Pittam, and the ring finger denotes the Kabam. All the three nadis are placed in a single artery, but the force is it must be perceived very properly. It can be obtained only by the practice. You have to practice very often, and we have to be very clear about the flow of the nadi so that we can easily find the changes in the nadi. If we are having any other change, if you have a sleepless night, means it will be depicted in the nadi as the increased presence of pitta. So if the pitta nadi is aggravated, means you can easily ask the patient whether you have a sleepless night or you have a burning sensation in the eye. Like that, we can easily isolate or we can easily depict the character of the pulse and the ailment easily. And then another thing too, by this, the Mathirai, I have said Mathirai, that is nothing but the magnitude of the pulse. The magnitude of the pulse is said to be Vadam 1, Pittam half, and Kabam quarter. The Vadam is, if it is double the means, it represents the primary change is with the Vadam. If the Pittam is doubled or represented as 1 means, then it will be the primary humor ruling all the other diseases. And if the kabam is half the presentation means, then that will be the primary humor which depicting the presentations all this. So by identifying the primary humor, we can treat the patient easily, and we can clean the root cause of the disease, and we can decipher the changes very promptly. Then the next tool is a Mutiram. That is, as I have said, it is the one which depicts the past of the body. By seeing the color, consistency, smell, froth, deposits, etc., we can see the changes in the digestion as well as the assimilation which had occurred in the body after the oxidation or all the metabolic process. It will be excreted through the urine. So if the urine is with the abnormal color or consistency or the smell, or if it is associated with the froth or deposits, means it denotes the changes in the metabolism that occurred in the body. So if we identify the change, and if we change that malformation or the malpresentation, that will give the proper results of the treatment. And then the next one is a very important one in the urine examination. We have a special thing in our Siddha. This is a very unique presentation in our Siddha diagnostic method, is known as Neikuri. In this Neikuri, we will be instilling oil droplet on the surface of the urine. The sample will be collected after the early morning, after 12 hours of rest. In the day before night, the patient is given with all the 6 days, and the early morning, the first urine will be collected in a bowel, and a small drop of gingerly oil, which is having the same specific gravity as that of the urine, it will be instilled in the center of the urine sample. It will denote the changes in the body. That is, if the oil droplet spread over the surface moves like a arrow or like a snake, it denotes the Vada presentation. Whereas if it is ring-like, it denotes the changes in the Pitta. And if it is like that of a scattered pattern, or if it is not moving in it, if it is like that of a instilled pale drop, it is said to be the Kaba pattern. And also, it also denotes that if the oil droplet spreads evenly and with a proper even timing, it denotes the good health. If it is not, if it is very fast in spreading, it denotes the ill presentation. That is a very poor prognostic value presentation. As well as the here we have to wonder, this presentation of oil, that is the spreading of oil, is mainly due to the changes in the soluble material as well as the suspended material as well as the mixed material in the urine, which is the resultant of all the metabolism of a 12 hours of urine. So this presentation, this surface tension will exhibit the various presentations or the shapes in the oil. So here this represents the immense spiritual scientist knowledge. Their what to say? They are more enlightened one. Those can even decipher the minute changes in the body. It has been mentioned in the Neikuri. If the presentation is like snake, means it will be the presentation of Vata. If it is like that of a oil droplet is scattered like the mustard seeds, means the patient won't get a proper prognosis. If it is get into the pitta-like presentation, means it denotes a very good prognosis in the disease pattern, or if the line of medication is proper way, means it shows the prognostic value. The asatyam may also come into the curable presentation. So this is a very wonderful science, which it is an extensive science which presents the presentation of disease as well as the prognosis of the disease. And then the next important one is the Manikadai node. It is a diagnostic as well as a prognostic tool. It is the prophecy of prognosis, in which the circumference, wrist circumference of the patient is measured. That is, the wrist circumference from the forefinger breadth is measured, and with the inelastic thread, and that will be measured in terms of the finger breadth of a patient itself. So this finger breadth, usually, I think you all heard about anthropometric presentation, which is the proportion of the body. We are presented with the proportion. We are having a symmetric in the body parts, so that this minute change in the finger breadth will depict the patient's health. If you are giving a medicine, if you are having a presentation like 8.5 finger breadth of this thread, means it will be presented with the certain disease patterns. You are giving medicines to that disease. Then you are measuring the finger breadth after giving the medication. And if it is growing towards 11, means it is a prognostic pathway. If the patient is having the finger breadth below 5, it denotes the ill prognosis, which will be giving that the patient will not have a proper cure. We will not survive properly. And then if it is more than 10 or 11, it denotes the healthy state of the disease. So we have all those unique presentations of unique diagnostic methods as well as the prognostic methods. So only I have chosen this topic, the uniqueness of Siddha diagnostic methods. So these are the few research articles. There are so many research articles present on the Yenbagai Tervu, Manikadai Nool, Neepuri, Neipuri, etc. Here are some present articles, research articles done by our institute faculties, and these are all these are all the few dedication to the Siddha's documentation. They have documented in the writings. We have to analyze, and we are not one to analyze. We have to identify those. We have to say this to the scientific world, so that each and everyone can admire and they easily follow this Siddha system of medicines. And my special thanks to the Almighty and the spectacular Siddhas for giving such an opportunity, and my beloved teachers who have enriched me with the knowledge, with this knowledge, and our magnificent institute, which is providing so many learning things. And then I thank Director in Charge, Professor Dr. Sendilvel sir, for giving this opportunity, and Dean sir, Professor Dr. Meenakshi Sundaram sir, for believing in me, and then the head of the department who has permitted me to do this with the wholehearted things, and all the head of all the departments present in the National Institute, my colleagues, and my family who have been support in preparing this presentation. Thank you any queries means I'm ready to answer.
Thank you so much, ma'am. It was a great webinar. We never knew that in Siddha system we can diagnosis can be happen with the fingers, with the voice modulation, then with the urine. This thing, it was great to know that. Participant, do you have any questions? I think, ma'am, you were quite clear, and it made us clear that how the Siddha system does their diagnosis. So thank you so much on behalf of Healthcare Sector Skill Council to you and to National Institute of Siddha, who always help us in organizing these kinds of webinars. Thank you, participant, for joining the session.
Thank you very much, ma'am.
Thank you so much.